how do I manage the sexual side effects of your psych meds? Oh, so this one is super nuanced, y'all. So number one, and when I say nuanced, here are all the disclaimers again. Talk to your team because there may be other things going on that are actually unrelated to your psychiatric medicines. And so that's where we're going to start is that number one, in our country, we don't talk about sex enough, and we don't do it in a way that's non-shaming and non-stigmatized. So even though everybody wants to have sex and thinks about sex all the time because that's just a normal human thing, um, uh, because of all that shame and weirdness, there's lots of times where people are suffering in silence. And so, and because we suffer in silence and we don't have enough resources for people with this particular concern, it makes it even harder to find someone when things aren't working the way they are supposed to. And so, yeah, and the first thing that you always have to do, any type of whenever you have any type of sexual dysfunction, is you really need a physical exam. You need someone to like lay hands on you to figure out, what your blood pressure is, if you have any other risk factors. Could it be any structural issues, depending on, so for example, if you have um, coronary artery disease, if you have atherosclerosis, where you have like plaque and things inside of your arteries, all of those things can make it very difficult to get an erection, maintain an erection. If you have diabetes, that can make your reproductive system not so healthy. So all these other things, drugs can do it. So certain like alcohol will make it very difficult to be in a state of mind or body where you can safely have sex. So all these things happen. And so you want to, before you say, "Oh, it's my psychiatric medicine that's doing this," I would say go talk to your medical doctor first and rule out and address any medical stuff that can happen. If you're generally healthy and this is kind of something that happens after you just started a psychiatric medicine, then yeah, sometimes that happens. Depending, especially with like selective serotonin reuptake inhibitors, SSRIs. Those are notoriously finicky about creating sexual side effects. And the key there is don't be afraid to mention it to the person who prescribed your medicine. And so, for example, I'll have people, adults that I see, because even though I'm a child psychiatrist and I work with kids mostly, I see lots of adults as well. And they will wait to the very last second of the appointment and go, "Hey, doc, just to let you know, yeah, so I don't have any desire to have sex." And I'm like, why don't you tell me that first so that we can cover all this stuff rather than, spending the rest of the time talking about other things because sex is important. It's an important part of your relationships and who you are as a person. And so there are things that doctors do in general with that. So sometimes it's decreasing your dose. Sometimes it's switching you to a different medicine completely. Sometimes it's using other medicines to treat that side effect, which we all hate doing. So, like most physicians hate treating a side effect of a medicine with another medicine. I know I hate doing it, but we always weigh the risks and the benefits. So, in other words, like if you're on this medicine, let's say you're on Lexapro, and it works great for you. It works great for your mood, for your anxiety, and you're like, "Oh my gosh, this is awesome!" But you have the side effect of low libido, meaning you don't want to have sex. Then it's my job to give you the options. Do you want to decrease your dose? Do you want to change to a different serotonin blocker? Do you want to change to a different medicine altogether, a different class of medicine? Do you want me to prescribe you something that could potentially help block those side effects? And so I bring all those up because, yes, psychiatric medicines can have sexual side effects. Yes, I want you to feel comfortable speaking up with whoever your prescriber is. Yes, make sure you get a physical. And there's all sorts of research that talks about the importance of all the basics for a healthy sexual being. So all of the sleep stuff that we talk about, make sure you get in sleep. All of the exercise stuff, make sure you get exercise. All the diet stuff. All three of those kind of domains are also important. And so, yeah, so we want you to feel comfortable reaching out about that, and make sure that if you have any questions, you ask them. So don't be afraid. Doctors are all trained, and counselors and therapists, they're all trained to deal with the awkward. And so just lean into the awkward, put it out there, and let us help.